I just think it just was it was a clash of forethought, thought, and great leadership. And when I say great leadership, not just myself, my entire leadership team, we were able to just quickly pivot. And, that takes a collective effort. That takes an operational effort from our COO. Definitely our chief medical officer having to deal with what the rapid changes daily at some points with the CDC, being able to be uh, headstrong in doing what she needed to do, from our chief quality officer making sure that her nurse staff and that we were able to open up test centers very quickly, to our chief financial officer saying, hey, I know this is a pandemic. What do you guys need to do? I will find the way to make sure we can pay for it and do it. And so, then we have our chief administrative officer making sure that, from a compliance perspective, FTCA perspective, that we were okay. From a telehealth state line perspective, we were okay, making sure we were billing from a billing director. So it just was a great, great collective. And you find out, in times of stress, who really is who they say they are. And I say that DVCH, Delaware Valley Community Health, really showed that we are leaders in this space, and we will continue to be. Because we didn't run and put our heads in our tails. We said, you know what, we're running right through this. And I'm so happy that we were able to do that.